Interesting story tonight in the Health Alert. A doctor in Los Angeles says he has a new way to change your look forever. He is lasering patients' eyes, permanently lightening brown pigment to blue. He says it only takes minutes to melt that pigment away. The surgery doesn't come cheap, though. Each eye costs as much as $2,500. So, unless you want to rock the two-tone look, $5,000 is the price tag you are looking at. Dr. Deepak Raja joining us live to talk about this. Dr. Raja, what do you think about this?
Well, I think that we need to see a little bit more studies before we can really judge the safety of this. I'm a little bit skeptical regarding a couple things. One, whether or not it can actually make the eyes blue by removing the brown pigment or the melanin that's present in our iris. Additionally, I worry about the release of the pigment that might cause light sensitivity or even block off the trabecular meshwork or the drainage system of the eye, resulting in high intraocular pressures, which can lead to glaucoma. In fact, there are some folks who actually have this called pigment dispersion syndrome and get pigmentary glaucoma, and I certainly wouldn't want anybody to suffer.
A medical condition that they would be dealing with.
They could certainly develop it over time, which I think is the concerning thing. I would be careful about being too much into the cosmetic appearance of one's eyes if it actually causes problems down the line.
Okay, so this isn't happening, I would imagine, in Florida. We are hearing that this West Coast doctor, this Los Angeles, of course, where stars are born, that's where this is happening. Would you suggest anyone do this at this point? Because this doctor is comparing it to LASIK, which is a procedure that is widely performed.
Sure.
Would you tell people to stay away at this point, or go ahead?
I would definitely reserve judgment at this point. In a sense, it's going to be a moot point because it has to undergo FDA testing in order to even be allowed in this country. It will probably be allowed outside the United States, and we'll be able to get better data as to whether or not this is safe and whether it's something that can be effective for people in the United States, but it's probably about 3 years away at best.
Okay. All right, Dr. Deepak Raja, I say what's wrong with brown eyes anyway? They're just as
I agree.
I like them. Okay, Dr. Raja, thank you so much for coming in.
Thank you for having me, Sunny.
For other videos like this, please visit our YouTube page.